secondary illnesses, and injuries. Topics to be covered. Topics to be covered in this module. Common secondary illnesses and first aid tips for each problem. Bleeding, diabetes, drowning, epilepsy, heart attack, cardiac arrest, shocks and so on, poisoning, sprains and strains, shocks, seizures, wounds. Bleeding. Serious bleeding occurs when a blood vessel is damaged by trauma and constricts. Normally, chemical reactions within the body will form a healing blood clot to repair or restrict the effect. But if a large number of blood vessels are badly damaged by a single injury, cuts and so on, severe bleeding will occur before clotting will eventually take place. Types of bleeding will be defined by the type of blood vessels and area damaged. An injury to an artery will be subjected to high pressure from the heart and can cause large blood loss immediately. But an injury to a vein can result in blood pooling under the skin, causing complications. Different types of bleeding wounds will need different types of risk management and treatment. But the common aims for a first aider treating bleeding wounds would be to assess the severity of the wound quickly and calmly, to control potentially life-threatening blood loss by elevating limbs and applying pressure, to comfort and calm the casualty, to protect yourself and others from blood infections, to prevent the casualty from going into shock, to ensure emergency services are alerted if the bleeding becomes life-threatening, to protect the wound with a fresh, sterile dressing. Diabetes. Diabetes is a medical condition where a body cannot produce enough insulin, which is a natural chemical produced by the pancreas that keeps blood sugar levels in the body at a normal level. A diabetes sufferer cannot control the amount of blood sugar naturally, so has to rely on a specialized diet and insulin supplements through injections and pills. Two types of diabetes exist: type 1, insulin dependent, and type 2, non-insulin dependent diabetes. A diabetic emergency will occur when a casualty has too little insulin, causing high blood sugar, hyperglycemia. A casualty has too much insulin, causing low blood sugar, hypoglycemia. Depending on the type of emergency, the sufferer may become drowsy, weak, confused, and ultimately unresponsive, going into a diabetic coma. In either case, if a first aider is treating someone suffering a diabetic emergency, they should call emergency services to say you suspect high or low level of blood sugar in a casualty. If they have insulin or medication on them, encourage them to take it. Monitor the casualty's vital signs and level of response. Give the casualty sugary food and drink, even if you're not sure if the blood sugar level is too high or low, it won't cause harm. Make sure they are resting and that if their responsiveness drops, you are prepared for CPR. Drowning. The definition of drowning is when someone cannot safely breathe because their nose and mouth are covered in water or another liquid. It's worth noting that the Hollywood version of drowning is often misleading. If someone has their throat and nose submerged, they are unlikely to be able to shout continuously or wave furiously at bystanders. It's more likely that they have got into difficulties and are slipping beneath the surface with little commotion. If someone has been rescued from a body of water after a possible drowning incident, there are some actions that a first aider can perform. The immediate action is to check that the casualty is breathing, whilst ensuring that emergency services have been called. If they aren't breathing normally, then perform CPR, 5 initial rescue breaths, followed by 30 chest compressions and another 2 rescue breaths. This should be continually repeated until emergency services arrive or the patient starts breathing again. Please note, if you become exhausted from the effort, assign a deputy to carry on with CPR. If they do start to recover, they should be treated for exposure to the cold and possible hypothermia, replace wet clothing, and give them warm blankets. Epilepsy. Epilepsy is a medical condition that produces chronic seizures. This can be down to brain disorders or inherited genetic anomalies, or several unknown factors. But at any point, someone with the condition could have a seizure triggered and suffer severe convulsions, muscle contractions, and lose responsiveness. There are different types of seizures, but each form can be distressing for the casualty and any bystanders. The cause is secondary to protecting the casualty and keeping them safe from harm. If a first aider goes to the assistance of a victim of a seizure, they should stay calm, assure bystanders and the casualty that this is a normal condition and they are in no danger. Allow the seizure to run its course whilst keeping the casualty safe. Loosen any tight clothing. Do not hold them down forcibly or put anything in their mouth. Keep the area around them clear until the seizure ceases. If the convulsions go on longer than 5 minutes, call emergency services. Check for medication or other medical conditions whilst waiting for assistance. Heart attack. Heart attack is usually used to describe a condition where something causes an obstruction of the blood to any part of the heart muscle. This will lead to a distinctive pain in the chest or arms. The heart will not be getting sufficient blood to beat properly, and if this isn't quickly resolved, the organ may fail completely, leading to a cardiac arrest. Angina is often linked to heart issues and happens when blood arteries become narrowed. It leads to attacks that are similar in symptoms to a heart attack but is not life-threatening until the blood supply becomes blocked. Blood supply issues to any part of the body can lead to a casualty going into severe shock. A first aider attending to a casualty with a suspected heart attack should call emergency services immediately. Move the casualty into a comfortable position, ideally leaning against a wall or straight-back chair with the head supported and knees bent. Give them aspirin, 300 milligrams if available, and they are not allergic. Be prepared for the casualty to develop possible shock and lack of responsiveness. Continually monitor their breathing and pulse. Be prepared to perform CPR and/or use an AED or defibrillator if the casualty goes into cardiac arrest. Poisoning. The term poisoning is generally used when a particular substance causes some kind of damage when a high amount is taken into the body. There are 5 common types of poisoning. Food poisoning. when contaminated or out-of-date food is consumed. Alcohol poisoning, when an excessive amount of alcohol has been consumed. Drug poisoning, when an overdose of illegal drugs or prescription medication has been taken. Swallowed poisoning, when someone takes in an amount of poisonous natural items, berries, mushrooms, and so on, or chemicals. Carbon monoxide poisoning, when someone inhales a large amount of this gas. In a suspected case of poisoning, a first aider can take the following actions. If they are breathing but not responsive, put them into the recovery position. Check for alcohol fumes or any evidence as to what caused the poisoning. Ask the casualty if they are lucid. Call emergency services if you notice toxic fumes or are unsure as to the poisoning source. Keep checking their breathing, level of response, and pulse. Don't make them be sick, as this could cause choking, but if they have already vomited, keep some samples in nearby containers to identify the poison. If the casualty is constantly vomiting or has diarrhea, give them plenty of liquids to replace any lost body fluid. If there are strong fumes, move the casualty away from the source without putting yourself at risk, and inform emergency services. Sprains and strains. Strains or sprains are injuries that affect the softer tissues in the human body. This is when major or minor damage has occurred to areas such as ligaments, muscles, and tendons. These injuries are rife in sport or energetic activities. They originate from sudden or unexpected movements of a limb or body, which cause the tissues to stretch or twist abnormally, which causes the tissues to stretch or twist abnormally. A sprain is specifically a ligament being torn or twisted. The strain is damage made to a muscle or tendon where it has been unnaturally stretched or torn, or even ripped, a rupture. A first aider should action the following to help a casualty with these conditions. Get them into a comfortable position according to the injury. Put an ice pack or cold press carefully on the affected area for 10 minutes only. Tie a support bandage carefully around the injury to immobilize it as much as possible. Raise the injured limb if possible and lay it on soft cushions or something padded. Arrange transport to a hospital or doctors. Shocks. This condition does not refer to an emotional state, but shock, where the body is placed into a life-threatening status, caused by restricted blood flow. A lack of oxygenated blood getting to organs like the brain and heart can lead to a casualty becoming confused and unresponsive. Shock can be triggered by various problems, such as bleeding, allergies, and so on. A first aider can treat a casualty for shock in the following ways. Lay them down in a comfortable position, ideally with the head low and legs raised. Call emergency services and explain that you believe the patient has gone into shock. Loosen any restrictive clothing or uniforms. Keep them calm and comfortable, as anxiety can increase the symptoms of shock. Monitor their breathing and responsiveness, and be prepared to perform CPR if required. Seizures. A seizure is defined as abnormal and excessive electrical activity in the brain, which can cause severe convulsions and spasms of the body. They can last from a couple of seconds to several minutes. We have already covered epilepsy, but this is not the sole cause of seizures in a casualty. There are three main causes of seizures. Epileptic seizures. As previously mentioned, these types of seizures are caused by brain dysfunction or can be genetically inherited. Provoked seizures. These are triggered by external influences such as alcohol, drugs, or low blood sugar count. They are known as provoked because they may be a one-off occurrence. Non-epileptic seizures. These differ from epilepsy seizures as they do not originate from abnormal brain activity, but from other sources such as fainting or stress. A first aider can help a casualty undergoing a seizure by moving them if they are in immediate danger, such as near a busy road or hot cooker, placing a cushion or some padding under their head, loosen any tight clothing or uniforms, put them into a recovery position when the convulsions cease, keep them calm and comfortable. Note the time the seizure starts and finishes, especially if it is their first one. Wounds. A wound can be defined as being significant damage to human tissue caused by a violent or sudden external force. There are 6 significant types of wounds. Incised wound. Clean and straight. This is normally caused by knives or very sharp-edged objects. Ligaments and tendons may be damaged, and there is likely to be heavy bleeding. Puncture wound. Deep but sometimes small in area. This is associated with a stabbing object, such as nails or the point of a knife. Dangerous because the majority of damage is likely to be internal. Laceration. Messy and indistinct, with major tissue damage. This is likely to be caused by a tearing or crushing action by a stationary or heavy object. Abrasion. Caused by skin being scraped across a rough surface. Not usually a major injury, but a wound can contain foreign matter. Avulsion. A more extreme version of a laceration or abrasion. Rough contact has caused the tissue to be literally torn away from the body. Heavy bleeding is likely. Amputation. A loss of a whole digit or limb. This is always classed as a medical emergency. These first aid techniques are universal in the treatment of all wounds. Call emergency services immediately if it is assessed as serious. Apply firm and direct pressure to the wound using a clean cloth or bandage until excessive bleeding stops. Clean and cover with a dressing. Never apply a tourniquet. Never push anything back into the skin or put pressure on large foreign objects. Only put on antibiotic cream when the wound is minor and clean. Do not remove blood-soaked bandages. Add more clean and fresh ones. Summary. What have we learned? Bleeding wounds differ in severity depending on the damage. There are significantly different forms of diabetes. Drowning victims should be protected from hypothermia. Epilepsy seizures should be allowed to run their course. Suspected heart attacks should result in an immediate 999 call. The causes of heart attacks and the symptoms. There are 5 different kinds of poisoning that can occur.